I'm Clare Wadsworth. I recently returned to practice as an occupational therapist, working with Nottinghamshire County Council. I worked before in the NHS. I was a clinical specialist in neurorehabilitation, a band 7 occupational therapist. And it was at a time when I'd just had my family. So I've got a young daughter. My husband was in the forces, he worked away a lot. My dad was diagnosed with terminal cancer and my mother-in-law was diagnosed with dementia. So we had a lot going on and it just felt right to step back a bit and take care of my family, so that's what I did. My daughter's at secondary school now and unfortunately my mother-in-law died recently, so I didn't have the caring responsibilities that I had before, but I decided then it was time to go back to occupational therapy and started researching the return to practice process. As part of that process, it was down to me to decide how I wanted to structure my return to practice, and it was down to me to organise my supervised practice and my study and identify my own learning needs. Then I started organising supervised practice, doing some private study and also engaging with Coventry University in their return to practice programme. I managed to arrange a number of opportunities, both with the NHS working on an acute ward and in outpatients, and then also with Nottinghamshire County Council looking at what opportunities were available within the adult social care team there. At the end of the day, I found that I could have worked in either area. My skills as an occupational therapist were transferable both within health and social care, and I was offered jobs in both at the end of my return to practice.
I'm Cate Bennett. I'm Principal Occupational Therapist here at Nottingham County Council. There's been a shortage of occupational therapists nationally for a number of years. And we recognise that people have experience, knowledge and skills from working as occupational therapists and then have paused their careers. And you know, for us to recruit people into our organisation who have that wealth of experience and those knowledge and skills is really important to us. So our process for return to practice is to contact us through the work experience page on the internet for the local authority. Once people have done that, it passes to me as Principal Occupational Therapist, and I can then build a bespoke package for that person that really looks at what their career aspirations are, what they've done previously, and where they live, so that we can find somewhere that's a minimal commute, you know, is the kind of role that they want to be working in the future, and they can have that shadowing experience in that type of setting. I urge colleagues who work in health and social care to really consider how they can establish a return to practice programme, having that bespoke package for people and tailoring their return to get the best outcomes for them. It will help you fill your vacancies. It's a win-win situation.